I'm a first-time mother and have been diagnosed with gestational diabetes. What does this mean? Will I go back to my normal sugar level after delivery?
Gestational diabetes is extremely common in India. One is that all of us are insulin resistant. Two, the age of pregnancy has gone up. Probably women have become more independent, career oriented. So the age of pregnancy has now gone up from, at least in urban India, from early 20s to late 20s or early 30s. That puts them at risk. Patients are becoming more and more obese by the time they're getting pregnant, so there is inherent insulin resistance. One needs to understand about gestational diabetes is that there won't be a single patient who comes to a doctor's clinic, whether a gynecologist or a diabetologist, with symptoms of gestational diabetes. Gestational diabetes needs to be screened and needs to be screened right from first visit, because the incidence is very, very high, and it needs to be, there are certain screening protocols which are mentioned across, and one needs to put those screening protocols with the help of a glucose tolerance test, identify gestational diabetics, because gestational diabetics are very high risk for fetal and maternal complications. So one needs to identify gestational diabetics by screening them at the earliest. Patients who have gestational diabetics go down to normal immediately following labor. People who are pre-gestational diabetics, that means who have diabetes before pregnancy, obviously the diabetes continues post-pregnancy. Some patients who are diagnosed with gestational diabetics in the first trimester, that's in the first 3 months, may have had diabetes before getting pregnant, and they may also continue with diabetes after pregnancy. Otherwise, as a thumb rule, most gestational diabetics go back to normal after labor.